Okay, so when we start the Dr. Dan method of neck curvature restoration, what we want to find is a nice flat surface. So you can be a countertop, your desktop. You can do this on the floor, but what we're going to do is we're going to have you place your elbows on that flat surface, just like that. Now, what we're going to do is we're going to have you look up at the ceiling, far back as you can. And what we're essentially trying to do is we're trying to extend the neck. So now what we're going to do is we're going to place the chin in the hands and relax into it. So you're just going to kind of sink into it. Boom. So now what we're seeing is we are stretching the tendons and the muscles of the neck, and we're going to hold this for approximately 1 to 2 minutes to start. Okay? Now, as time goes on, we're going to stretch this up to 10 minutes, once a day. That's it. No more, no less. Now the problem is that I will have some overachievers that try and rush through this, and they will try and do half an hour, 3 sessions of 30 minutes, 3 sessions of 10 minutes. The trouble is that when you irritate the neck, the muscles will go into spasm, the neck flattens out, and you don't get anywhere. So the magic number that I found is 10 minutes for this type of stretch, and you're just holding it, just relaxing like you're trying to fall asleep in class. Okay. So that's the stretch. Now we're going to go to the exercise. We have to build up strength in the muscles to hold the new curvature. So what we're going to do is we are going to lie face down on the floor, and all we're going to do is we're going to extend back and look back as far as you can up at the ceiling, just like that, and then go down and up and down. That's it. So what we're going to start with is we are going to start with 10 reps, and then we're going to go up to 50 reps a day, and that consistently will bring that curvature back. This will be hastened if you are getting adjusted by hand by a chiropractor. If you ever feel like the neck kinks and it's getting stuck and it doesn't feel good, then you are to seek out your chiropractor and get the neck set, because the exercise will cease to change the neck curvature at that time. So if you're sore afterwards, because we are creating a new curvature for the neck, if you're sore afterwards for a couple hours, fine. If you are sore for more than a couple hours, take a day or 2 off and then hit it again. Sometimes you have to do this for a good 6 to 8 months to get the full curvature restored, and it depends on how long it's been lost, the amount of arthritis, and your resistance to change. But the good thing is that when you put the curvature back in the neck, then what we will see on girls is you tend to get the hump right here in this area. And what's interesting is once you get the curvature back, then that hump just flattens out. And so you're taking all of the pressure of carrying the head around and you put it right back on the neck where it should be. So we do not want any sort of necks that look like this. Those are just gross. You don't want to have a neck looking like that. Man, it just starts falling apart. You want to have a neck that looks just like that, which is the normal curvature. And believe me, I have had 90-year-old patients that have neck curves that look just like that with a 0 arthritis. And remember, arthritis is a matter of the amount of cervical curve that you have, the past cervical damage that you've had, just different factors like that. But here is Dr. Dan's neck right there, and that's just goes to show you that I walk the talk, and that is a good-looking neck with no arthritis. And I am 50 years old right now, and that is how we get the neck curvature restored. If you have questions, comments, by all means, reach out to me at Dr. Dan the Man on YouTube, Body User's Guide on YouTube, or if you don't know who I am, then you better check my resume on downtowngilberthealthcare.com. Thank you.